Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to episode 12 of the Canine Culture Podcast. This is your host, Brittany, and we have a special guest today. Her name is Dr. Hailey Freeman, and she is a vet out in Texas. So welcome to the show, Hailey.
Hi, nice to be here.
So today we're going to talk about probably one of the most important topics for dog owners, and it's applicable to every single dog owner, and that is preventative medicine. So before we jump into talking about preventative medicine, tell us a little bit about yourself, Hailey.
Yeah, so I am originally from Louisiana. I am from Sulphur, Louisiana, and I did undergrad at McNeese State in Lake Charles, Louisiana, and then I went to Mississippi State University College of Veterinary Medicine for my doctorate degree. I just graduated last May in 2021, so I'm kind
Congratulations.
of a fresh grad, kind of just learning the ways of things and trying to dive in and continue learning and applicating what I learned, all those years ago. Feels like, but it's actually just happened recently, but it feels like forever ago while practicing. I've been working in Southeast Texas. I'm where my husband's from. So kind of starting here and working in general practice and trying to get the ropes of everything. And then trying to, relate with clients and discuss preventative medicine. It's kind of one of the main things I'm kind of passionate about is implicating preventative medicine for my patients, and then trying to figure out what I love the most. I kind of loved everything. So I chose not to specialize in the beginning. I just couldn't choose something. So general practice kind of where I wanted to be. And I've loved it so far. It's been pretty busy. It's been different, but I've actually loved a lot of it. So.
Yeah, that's awesome. And congrats, you graduated during COVID, so that was probably a little bit interesting.
It was actually totally different trying to get to talk to clients when we first started, because when I first started clinicals in my third year, we were talking to clients with a mask on, but they were in the room and everything, and then we became curbside. So talking to clients in the room was kind of foreign when I first started. I used to actually go to our Beaumont location in Beaumont, Texas, and kind of talk to clients in the rooms while I was still working to kind of get used to doing it again, because your body totally retrains. You go to a car door and you talk to someone for 30 minutes, and then your body doesn't used to having that one-on-one interaction. But it was kind of crazy, but now it kind of feels natural that we're back in rooms together and stuff with clients. So it's much better for sure.
Yeah. All right. So let's talk about puppies. And so I want to jump in with puppies because a lot of people, that's probably where their head goes when they think preventive medicine. And it's, my puppy's this many weeks old. I need to take him to the vet and do shots. So starting as a puppy, at what age do they get their initial shots? What are those shots? And what are the importance of those? And I know that's a loaded question that's going to have a long answer, but I think it's a good jumping off point because this is kind of where everyone starts.
Yeah, absolutely. So we start seeing your puppies at 6 weeks of age. And a lot of clients who buy puppies from different breeders will bring them to us sooner for like exams and to make sure there's no other, hernias or heart conditions that we can hear, but we truly don't start vaccinating until 6 weeks of age. Every patient is different, because some people get dogs at 8 weeks or 10 weeks or 12 weeks that do or don't have vaccines. So the schedule kind of changes, but kind of the standard is we start at 6 weeks and you get 4 sets of vaccines. You would start at 6 weeks, and then you come back in at 9, and then 12, and then 15 or 16 or so. We try to vaccinate up to at least 16 weeks of age, just because when they suckle on mom's milk, they get antibodies. Mom has antibodies from her vaccines. And we're trying to fight that. And we're trying to vaccinate them to where the mom's antibodies are waxing and waning, and then they leave. And then we're vaccinating and letting the animal have its own immune system. So it's kind of different. Every dog is different, especially when they come to us. But we start at 6 weeks of age for sure.
Okay. And then at 6 weeks, what do those shots look like? What do the initial shots consist of?
So when you come in, like let's say you came into our clinic, everyone's kind of different. We usually start you off with a small vaccine. So you for sure always get the main core vaccine. So you kind of have core vaccines, and you kind of have other vaccines that are just additives. The main core vaccines that we have for dogs would be distemper, adenovirus, and hepatitis, parvovirus, and parainfluenza. It's called a DAPP vaccine. That is vaccine is what you would get on your first series coming to us. That is the vaccine that is boosted every series of shots. Every time you come in, for all 4 shots, that vaccine is boosted every single time. It's pretty important, and we'll kind of dive in to what those all mean. But those are the first sets of vaccines that you would get. And we usually also add something called Bordetella, and we can kind of go over that too. So distemper, we can kind of get to that. It's kind of a virus. It's super contagious. It's multisystemic. Dogs are the main host for this virus. They're usually responsible for almost all infections, including wildlife infections, and they're most commonly spread through respiratory secretions. However, they can shed it in any bodily fluid. So that's kind of the first one we see with distemper.
And distemper, you can get that at any age. So if a dog isn't vaccinated and they're 4 or 5 years old, they can get it, right?
Yes.
Okay.
Loaded DAPP vaccine, that distemper is that first part of it. The second part of that vaccine, there's 4 parts of it. The second part is adenovirus or hepatitis. And that one is transmitted basically kind of from animal to animal contact. It can be from bodily fluids, feces, urine, saliva. And that kind of more or less is a virus that kind of attacks the liver. That's another part of it. And we can go more in detail of these all too as well. Parvovirus, what we all know, is the third component of that vaccine. It's one of the most lethal, viruses in our puppies. It's what we see the most common. We see parvovirus literally all the time, especially here in Southeast Texas. We have the climate for it. It can survive in the environment for years with the right conditions. And it's one of the things that can cause, vomiting and diarrhea in our puppies. And it can cause, anemia and just severe things. It can also cause sepsis and bacteremia. And it's one of the things that we truly push to vaccinate for. It's one of the things that people don't really understand of why we're given so many vaccines. And that's why. And then parainfluenza is the 4th component of that one vaccine. That's more of a respiratory virus. And that consists of kind of, coughing and those types of things. But that's kind of the main one you'll get at every single vaccination. You'll get it at 6 weeks and 9 weeks and 12 weeks and 15 weeks, just to booster that so many times to build that immunity that is needed, because it's that important. Those 4 are in that one core vaccine, and it is required to have that when you're coming in and getting puppy vaccines for sure.
So for those 4, are there any of those that you repeat on a annual basis after that puppy stage?
Yes, that vaccine is repeated for us every year. Some clinics will repeat that every 3 years. There are labeled vaccines that are labeled for 3 years for that one. I honestly enjoy the every year, but some people do promote every 3 years. And it also kind of depends on also when they get older. Some people will try to say, let's do it, every 3 years. It also depends on the dog and the anxiety and those things too as well. We do it every year here just because it's so prominent, and just because, you see these things so often. Without vaccinating. Now the distemper, not so much if they're vaccinated. The parvovirus, as they get older and as they continue on with vaccinations, you don't see it as much. Parainfluenza is one of those ones where you can see it, and it's harder to describe and see and differentiate from other things that we have. And the hepatitis, if you keep vaccinating for it, usually you don't see it as much. But that is one of the ones that we do every single time. So let's say you brought your puppy in, I would kind of give you a series of shots. So if you brought them into me at 6 weeks, we do distemper, adenovirus, parvo, parainfluenza, and we'd also do something called Bordetella. Bordetella is a respiratory pathogen. If you are in any situation where you're going grooming, you're going to board, you're in a shelter setting, you're in a dog park, you're at a high traffic area, you're always predisposed to that bacterium. And that's one of the ones that we start them off with, just because puppies have a lower immune system, and we kind of start them off with that one first. So at 6 weeks you'd get the DAPP vaccine and Bordetella. And then we'd also start you on something called coronavirus, which is not the same as coronavirus humans. I actually have a lot of people who get mad at me for giving their dogs that vaccine. I'm like, it has no correlation. I'm sorry.
Mm-hmm.
So it's more or less a GI virus, but it can cause respiratory issues in our patients. And that's one of the main ones that we give to as well at your first set of puppy shots. Between every set, we wait 3 to 4 weeks just for the immune system to kind of revamp if you must. Usually it takes about 10 days-ish or so to kind of build up that immunity, and then kind of let the immune system kind of, die back down and be ready to have more vaccines and kind of ramp back up again. So you kind of wait that 3 to 4 weeks, and it just depends. Some people come in 3 weeks and some people come at 4 weeks. But we would booster, if we gave you all of those on the first set, we would booster those again on the second set. And then when you come in on your third set, we would give you the DAPP vaccine again. Then we would start you on something called influenza, which is also a respiratory pathogen. It's a virus. And then we would also, we'd booster those on the fourth set and also give you rabies.
Okay.
And then with the DAPP vaccine, where we gave you coronavirus the first 2 series, we would give you something called leptospirosis the next 2 series. Our vaccines are kind of put together, like we mix them together. Like corona gets mixed with DAPP the first 2, and then lepto gets mixed with the DAPP for the next 2. But some people actually have them as individual vaccines, so it kind of just varies where you go. That's just kind of how we do things. Leptospirosis, I know I kind of rushed into that. We do them on the 3rd and 4th vaccine, just because it is kind of one of those vaccines that causes more reactions in our patients. So we kind of let them have more of a mature immune system and get used to having vaccines and things. But everyone does it differently, honestly. But we like to give it the last 2 sets. But that is one of the things that you can get from your patient drinking stagnant water, any coming in contact with infected urine and those types of things. And it is kind of a disease that attacks the kidneys, and can cause some liver issues too as well. But we would boost at your 4th set. And then usually at your 4th set, when you're graduating, your puppy vaccines, I call it graduating. I always tell them that people's always like, look, you graduated vaccine school, it's kind of a happy cheers moment. You get your rabies vaccine then. We don't vaccinate for rabies before 12 weeks of age. Legally, we vaccinate at 12 weeks or older. And we kind of gave you that, and you get a cute little tag to take home and parade around that you got your rabies vaccine. Rabies is a core vaccine. It's required by law. So if you come in, a lot of people will kind of say, let's only get a rabies vaccine. And if you come in for a rabies vaccine, you have to have an exam. And not a lot of people understand why. And that's kind of more of a state regulation type of thing. So it's more or less by law, we have to do that.
And I know for you guys, you do rabies yearly, right?
But you can do it every 3 years.
Okay.
And
I think that's what I did. Yeah.
And it kind of goes by state regulations. It kind of goes by, also your practice and things too as well. It also depends on if you buy the 3-year versus the 1 year. Most of the time they make a 3-year vaccine, and sometimes people just use it every year. It kind of just depends on what your practice carries to as well. But you're right. It can be given it can be given 1 year or 3 years. But the first time, so the initial first series, let's say I give you rabies at your fourth set of puppy vaccinations, I have to give it to you again in a year. And then after that, it can be a 3-year vaccine, but it has to be that booster has to be in a year for sure.
Would there be any harm if, let's say you did a 3-year and then 2 years later you switched vets, you weren't totally sure, can you, I don't want to say overdose rabies, but if you get that 3-year, but then you don't ride out the full 3 years and then get another 3-year or a 1 year, is there any issue there?
I haven't seen any. Actually, it's kind of one of the things that does happen a lot We have people who say, well, it's a 3 year before, but I kind of want to make it a 1 year with you guys. I want to come in every year and do it. You definitely can. There's no harm to it. And actually, when you call the state or local vet to report, let's say a dog got bit by a bat and it's coming in and they're nervous about exposure and those types of things, the state vet like here will tell you to vaccinate, now vaccinate again and booster it, and then booster it 2 more times. I think it's at 6 weeks and then another 8 weeks as well. So that they do allow certain circumstances where you can booster that vaccine more frequently. But we've seen pretty safe things with it. We haven't really seen any issues giving it, 1 year versus 3 years.
Okay, that's good to know because I wasn't totally sure. I know, like you said, every state is very different. And then
And other people may,
another.
I have seen it. I haven't seen them
Mhm.
here. Calling our state vet and talking to them. I even asked the same question too, and they're like, no, it's kind of needed. So it's kind of maybe situational. Some people may have seen it, but I haven't seen it here or even heard of it when kind of doing research and stuff too as well.
And then one more you mentioned was Bordetella. So we used to do Bordetella annually, and then I actually went to every 6 months. And uh, what do you guys normally do there, or what would you recommend? And I know it's going to be different, if your dog's being boarded all the time, if they're always at the dog park. For us, we started doing it every 6 months just because we travel a lot, and you just don't know when your dogs are going to be exposed to another dog or in close, corners with another dog, and maybe they could get infected. So just to be safe, we've done it every 6 months.
Absolutely. And like the vaccine shows protection for about up to 12 months or so. But however, like you say, you're in those high risk scenarios, you're traveling, you're around other dogs, you're being exposed. We do have people who do grooming and boarding that come and get it every 6 months just to boost that immunity. Bordetella is also one of those vaccines where a lot of people get angry with us because we do use it every year. We give it every year at our annuals. And anytime a patient, gets sick or comes in and gets spayed and is boarded, there's always a risk that you can get it. It doesn't prevent the disease. It kind of just, decreases the morbidity whenever the disease does occur. Like it decreases clinical signs, helps with, shedding, and it also helps, the course of disease be a little bit less severe, let's say, than it would be if you weren't vaccinated. And a lot of people are like, we had the vaccine. I'm like, of course you had the vaccine. Now you're a patient. It's kind of like the flu vaccine. You're supposed to be able to get the flu vaccine, and it's supposed to help decrease the clinical signs that you see. And maybe, you recover in 3 days versus like 7 days or so. That's
Right, just
kind of
like the flu shot.
yeah. And that's kind of the same with all of our respiratory, like vaccines. Influenza is the same way. At our annual vaccines, influenza is kind of optional. We require it as a puppy, and then it's more or less optional because it's not a core vaccine. The only core ones that we have are the DAPP and rabies. The rest of all our other vaccines are kind of optional. Influenza is one of those ones that we give an option to. We don't see it as much as, like you don't vaccinate as much because if you're not in the same setting or scenario of being in high risk exposure areas, we kind of let you kind of not vaccinate every year. I recommend always vaccinate every year because even if you are in a single pet household and you're going around someone who is exposed to that, they can bring it home in their clothes and things like that too as well. So I always recommend it, but people will decline it, and that's kind of the only ones that I'll let them decline. Everything else I make mandatory, unless they're just, I want only rabies type of thing. And then we kind of
Hmm.
talk about the risk and everything, and why we choose or choose not to give a dog a vaccine type of thing like that.
So you kind of hinted at this, and you and I talked before we started recording. How often do you think that dogs should come in? And before you answer, I know anyone listening, you think of an annual wellness exam, and a lot of people think, I'll just skip it. It's just an exam. But at the same time, dogs are aging much faster than humans. So, for us, we might go to the doctor every 1 to 2 to 3 years. It depends. It depends on the person. But I mean, for dogs, they're aging so much. I mean, you might be able to speak to this. A lot of people say 1 year in human years is 7 in dog years or whatever that is. But that's actually not even a true correlation because there's so many other factors with respect to genetics and the dog's activity and how healthy they are and any comorbidities they may have. So good rule of thumb, would you say see your vet at least once a year?
I think so. I mean, patients who come in every year, that allows me to do an exam on that patient every year, put in my notes that we didn't have a heart murmur this year. We didn't have any lameness issues, everything checked out great. No issues in that exam. And then, the next year you come back and in just easy as 1 year difference, I've diagnosed heart murmurs in patients who didn't have heart murmurs last year. Having patients who maybe had a very low grade heart murmur that come and present, in congestive heart failure, and they have a raging heart murmur now that's progressed very rapidly. I think it's very important. Even in just a year, I've had dogs gain, 5 or 10 pounds, and they're like, wow, maybe we should check your thyroid. You're at that age of being an older patient, and the owner's like, I haven't been feeding, a whole lot. We've been trying to lose weight. We're having a hard time. Just those simple things. Monitoring dental tartar. Small breed dogs are very prominent to getting dental tartar and building that tartar up even in just a year. I've seen dogs who have had, dental exams and dental cleanings, and then 6 months later have significant tartar on the teeth. So just those types of things, and just saying, oh, we look great this year. We'll see you again next year. And I think every year, honestly, and I promote that even with vaccines. I was talking to a client yesterday, and she was also on the 3-year vaccine schedule. And I was like, if you want to be 1 year, that's perfectly fine. If you want to be 3 years, I'm on board too, as long as the exposure versus risk and everything is minimal. But I love to see your patient every single year. I want to be able to help promote preventative medicine for you, to diagnose things early and try to help you, decrease the risk of morbidity in certain diseases for your patient. Notice a lump this time you come in that wasn't there last time. So absolutely, every year. I know it's kind of tasking, because some people kind of think, we make a lot of money off of them, and it's really not so. It's more or less that we care so much about their patients that we want to diagnose things early, type of thing.
Right. Yeah. And two things that you mentioned, it's kind of ironic. So we had our annual exam back in July with Titan. He's our 12-year-old Pomeranian, and had a dental. Teeth looked great, no heart murmur. And something kind of came up a few weeks ago, and we had to take him to the vet. He now has a grade 3 out of 6 heart murmur, which wasn't there before, and his teeth got so they got terrible over the course of 6 months, where that annual was fine, and now he's going to be on somewhat of a 6 month schedule, which our other senior, she's 13, she's kind of on a similar schedule too. Granted, they go to acupuncture once a month, so we do have those vets like feeling around on them and working with them. But yeah, the dental, I mean, his teeth have been perfect, and now all of a sudden they're just having so much more buildup. So yeah, we couldn't even probably have made it to our next annual, because he already had a tooth come out. We already scheduled another cleaning. So yeah, I hear you on that.
I think especially as your patient gets older too, I think it's even more important as they age, especially after 5. 100%, I want to see you every year. I want to do blood work every year. I want to do preventative medication for you, and just kind of monitor things, because that's kind of when things get a little bit rocky. That's when they're like, wow, my dog has been so healthy. And I'm like, yeah, but we're getting older. And like, we're only 5. I'm like, yeah, but 5 is a little bit is getting older. That's at that mid
Right.
range. Most of our pets, unless they're large breed, and that's kind of older for them too. So yeah, absolutely.
So what are some other things aside from vaccines and you know, dental cleanings, different things like that, that we could consider preventative medicine?
Heartworm test is a big one of the biggest things in this area. The mosquito, I always tell my clients that it's basically a state bird here. We have mosquitoes all the time. If there's a body of water, there's mosquitoes, especially in Southeast Texas. I'm sure it's the same for you in Florida.
Yeah.
They're just a nightmare, and any mosquito bite you have can lead to heart disease. We've had patients who have been on prevention, and nothing is ever 100%. That's the hardest thing I have to stress to clients, is that yes, you are on prevention, but nothing is ever 100%. But if we're testing every single year and something happens, we can have those facilities and those companies show them records and say, hey, my client has been diligent. They have given this heartworm prevention every 30 days. And I'll harp on that too. If you're given an oral prevention, it must be every 30 days. It's a back kill of any type of microfilariae that's been given by a mosquito bite that makes adult heartworm. And I know we're not kind of going into the big life cycle of heartworms and things, but it's about 6 months from mosquito bite to an adult heartworm. And so given that medication every 30 days is how you prevent that. So if you're diligent and you give it every 30 days and you have those tests to prove that you've been negative for so many years, and oops, we have a positive, it's best that I know that year versus 3 years from now when it's been causing damage in the heart and been causing irreversible changes that will never come back to go back to normal. So heartworm disease is one of those things that we see dogs who have never been to a vet and come knocking on death's door into the office, and I can't do much about it. At that point it's either you go to drastic changes of saving the pet, spending thousands and going to specialists for certain procedures that are needed, or unfortunately we have to do as much as we can, and then we have to talk about humane euthanasia and things. So heartworm disease is deadly. Now, I'm not saying your dog has heartworm disease today and we put you on the path of treatment and your dog just dies tomorrow. No, it's not necessarily that point of it, but catching it early will prevent those deadly changes that can cause issues in the future.
Yeah, that makes sense. You see a lot of owner surrenders to rescues and stuff because their dog has heartworms and they can't pay to treat them because it's very expensive to treat them. But unfortunately, it was on the owner. It's preventable. It's very easy to prevent. The medication's not that expensive. And it's one of those things that if you're getting a dog, you probably need to budget for that expense, just like you do for their food. You need to set aside some money for their vet visits, maybe for some ER visits. So that's a good one to point out because I've seen that a little bit more recently in Florida, a lot of owner surrenders of dogs that have heartworms. And it's very financially taxing on the rescues and the dogs. They have to be kept separate. They have to be calm, kept in their kennel, low stress. And it's tough to do when you're in a new environment and you're in a rescue with other dogs.
Yeah. And it is preventable, kind of like what you're saying, given that prevention and kind of even marking your calendar. I mean, I know people forget I do this every day for a living. And this month, I think I was 2 days behind on my dog's prevention. And I was like, oh, great. I mean, and I tell people that all the time in exam rooms. I'm very real with my clients. I'm like, hey, I do this for a living. I do this every day. I talk to clients about heartworm disease every day, and I still have to mark in my calendar when to give it to my pet. So,
Mm-hmm.
like, oh, you gave it the 17th of this month, make sure you give it the 17th of next month. Just pick a date. Makes your life so much easier because it just takes one missed dose and they're a heartworm disease right there. So,
Mm-hmm.
and it is one of the main things that we see, that we consider, preventative medicine is just getting heartworm tests every year.
Right. And now, this is the last question. I know we're coming up on time. Is there a very common or the most common issue you see dogs come in with that could have been prevented with some type of preventative medicine, an annual shot, their annual exam? Like, aside from the heartworms, is there anything else that always comes up that you're like, man, this was preventable?
Yeah, parvovirus. And I will kind of harp on that, only because I've seen it a lot in the past couple of months. It lives in the ground for years. It can survive 2 years. It's one of those things that you can prevent by giving vaccines, especially to puppies. We have a lot of people who don't want to really kind of come in and get vaccines from us, and they'll kind of go to a feed store and get
Mm-hmm.
vaccines. This is one of the most talked things that I tell my clients, and I kind of truly make them understand why. So our vaccine company that we use, they can promise me that vaccine was refrigerated from point A to point B into my refrigerator here at the clinic. They can promise me if something goes wrong, they're going to help as long as I have proof that we've been vaccinated with their vaccine. Feed
All right,
store
I got a
vaccines.
squirrel.
Fine. Feed store vaccines. Yes, they look like they're refrigerated when you get there. I can't promise you that virus is viable whenever it goes in your pet. So you might be spending money and vaccinating your dog, and then you bring him to a camp or a place where you're going hunting at, where there's wildlife and things that are out there that have these diseases, or even in your backyard if you're renting a house somewhere. You don't know the history of that yard for 2 full years. That is one of the most common things I see, is that a dog had vaccines from a Tractor Supply or a different source, and they came in and they're coming in they're still young and they're coming in for parvovirus, even though they had that one vaccine that wasn't even viable. So that is one of the main things besides heart disease I've seen recently. And also one of the things too, as well, is anemia from parasites, from mainly hookworms.
Oh, okay.
Around from feces from other animals, and that can suck the blood from the intestines and cause severe anemia. I've seen dogs who have presented who went agonal and died in front of us from being so anemic, so pale, and so weak. We've had dogs who had raging diarrhea and had to have significant hospitalization just from having hookworm anemia, and it's one of those are maybe the top three things that we've seen, especially in this area, is heartworm disease, parasites and anemia from hookworms and things, and parvovirus. All of those things can be prevented. Giving a prevention every 30 days for heartworm disease, deworming and doing fecals every year for your patients, checking a fecal every year, because if they go across a high burden of worms and you're giving that prevention and it doesn't kind of catch that dose that's needed, it can happen. They can slip through the cracks, and then for parvovirus, making sure that we're getting enough vaccines and coming more than just 1 or 2 times to the vet, making sure you're getting that exposure for those full 4 sets. Now, if you bring a dog in that's like, 16, 20 weeks of age, yeah, giving two vaccines then is a good enough immunity, but making sure that patient has enough immunity, because it's everywhere, especially here. We have people say, well, I
Yeah.
just, visit a friend and their dog had it. I'm like, well, your dog probably will have it in a couple of days. So it calls about it all the time. Those are the top 3, I would say, in the last 4 months or so.
Okay.
And it's heartbreaking.
Yeah. Well, I really appreciate you being on here and just helping provide some education on the preventative medicine piece. Like we said all throughout the episode, it's called preventative medicine for a reason. You can prevent some of these very deadly diseases, and it's not hard to prevent. So this is definitely one of the most important topics that we're going to talk about. So I appreciate you being on.
You're very welcome. If you have questions and things like that, or if people have questions about preventative medicine, I'm always open. They can always call the clinic too as well. I think it's very important to make sure that we take care of our babies and give them the chance to fight off things that they can prevent themselves.
Yeah. All right. Well, I will let you go and get back to any more work you have to do. And like I said, thank you so much for being on. We appreciate it.
Thank you. And thanks for inviting me on.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.